flag of freedom.
Hello. Good morning. Another Saturday is here with us. You are welcome to the Health and Wellness Hub show on the Sienna Media TV on YouTube and Facebook. My name is Miss Del. I'm your the usual host here. Yes. Today we're gonna be talking about cancers. Yes. We've been hearing and we know people, our friends, our loved ones, our family members, people who have gone through any who have had any form of various forms of cancers, any form of cancers that There are a whole lot out there. And today we have a very experienced oncologist, a doctor who's going to be talking to us about cancers in general. I mean, what happened? What is cancer? Why all of a sudden, I know we hear about this name cancer, the disease that is really, really, really troubling us and killing a lot of our family members, our loved ones, and people we know, people we don't even know all around us. So today we're going to be learning about cancers, and so we can guard ourselves and know what to do and what not to do to fall into that trap of this deadly disease or sickness called cancer. And so please call your friends and loved ones, your family members, tell them we are live, tell them to come and listen. Let's all educate ourselves so we can live healthier lives. So in a minute, please share the link, and we'll come back and I'll introduce our special guest in the studios. Thank you. All righty, welcome back. As I said earlier on, this is the Health and Wellness Hub show on the Sienna Media and TV. We're showing on YouTube and on Facebook, and my name is Miss Dill. Today we're going to be talking about cancer. We're going to be learning a lot about cancer. What is cancer? What is this deadly disease and sickness that is troubling us? And so we know what to do and what not to do. Okay, so I'm going to go ahead to introduce our special guest in the studio. His name is Dr. Michael Yao Ashibi. He's board certified in medical oncology and hematology and internal medicine. Well, he just retired in September 2024, but he still has a lot of knowledge and experience that he's going to share with us this morning. Welcome, Dr. Ashibi.
Thank you. Thank you for inviting me.
You're welcome. We're privileged to have you on our show today. So, Doctor, what is cancer? I know you have something to share with us about cancer, so please go ahead and share with us.
Okay, so I'm not certain which format will work the best for everybody on the channel, but what I like to do is share some brief remarks and then give people the opportunity to ask questions about the issues that are dear to their heart relating to cancer, so I can address them specifically. This way I can feel that their needs are met.
Sounds good.
So to begin with, I think we should put things in perspective. People need to know that the number one cause of death in the US and globally is heart disease. Now, cancer is number 2 in the US, but globally is number 5. So I'm saying this because if we put all our energy to prevent and cure cancer, we may still die from heart disease because that's the most likely cause of death in the US and globally. So we need to keep that in mind. As we avoid and treat cancer, we need to pay attention to heart disease because we are more likely to fall to that than cancer. Okay, now what is cancer? So in order to say what cancer is, we need to at least review some of the aspects of what is normal in our bodies. So our bodies are made of lots of building blocks called cells. And normally there's a control mechanism. So when the body needs to grow something, the cells can divide. And then when they get to where they need to go, then they can stop. When the need arises, they can grow again. So this mechanism of control is very critical to help us grow, get bigger, get other things that are important for us. And in cancer, this control mechanism is gone awry. So imagine driving on the highway, the accelerator, let's say your foot is stuck on the accelerator, and so it's going, the brake is not working. So when that happens, it's a dangerous situation. The cells just divide and divide and divide without control. So it can form a mass, it can spread to other places, and therefore lead to death. So cancer can be dangerous in that regard because the normal control mechanisms are no longer working for that particular group of cells. So cancer doesn't have to be a mass. It can be in the blood where there's no mass, but there's cancer. But a lot of the time, it may be mass, it may infiltrate, and may spread. So yes, cancer is a deadly disease, but it's number 2 cause of death in the United States, number 5 cause of death globally. So pay attention to your health as a whole. Okay, now it's important to know that to be sure somebody has cancer, it requires a biopsy. A biopsy is a tiny piece of tissue taken from where the tumor is and is examined with special techniques under the microscope, other tests, to confirm that indeed this is cancer. Because not every mass is cancer. You can have a benign tumor. So I've heard of people who said they have cancer, they were given 3 months to live, and they lived 30 years. All that is possible, but it's important to know that some of these people didn't actually have cancer because a biopsy was not performed. What looks like cancer may not be cancer. You need a diagnosis. And diagnosis means pathologic evaluation to be sure that this indeed is cancer. Okay. I've had patients who had masses in the chest X-ray on the lung, and the doctor said, "Oh my God, you are eaten by cancer. You're not going to be here 3 months from now. Go take care of your affairs and make sure everything is in order." And it turns out that what they thought was cancer was not cancer. So what is important is that to say someone has cancer, it requires pathology diagnosis. Now, there are many types of cancer. Somebody asked me, how many types of cancer do we have? And the answer is we have more than 100 types of cancer. You can get cancer of the scalp, the hair follicles, the mouth, the eyes, the heart, lungs, breast, prostate. Almost any tissue in the body things can go awry, you can develop cancer. So we have hundreds of types of cancer. Now, it's important to face what the biggest problems are. In the US, the number 1 cancer that's diagnosed in women is breast cancer. In men is prostate cancer. And I want to get a chance to mention that breast cancer is not just women's disease. 1% of all breast cancers in the world occur in men. Because men have nipples, they have a small amount of breast tissue, and sometimes that can develop cancer. Now, before I go to the next step, I want to stop for a moment and ask if anybody has any questions so far that's bothering them about this.
Okay, Doc. I don't see any question here for now, so we can continue until when the questions come. Then we'll take them as they come.
Okay. So there's a difference between what is the commonly diagnosed cancer and what is the cause of cancer death. I say that because not every cancer kills the patient. The number 1 most common cancer diagnosed in women is breast cancer, but the number 1 cause of cancer death is not breast cancer. It is lung cancer. So people need to pay attention more to the cancers that cause death, more than the cancers that can be diagnosed. For example, there's a lot of early, slow-growing, relatively less aggressive breast cancer diagnosed in this country every day. And that's the reason why the cost of diagnosis of breast cancer is increasing in the US. Mm-hmm. So cancer is growing or increasing in number, but the death rate from cancer is actually declining, especially in men. Some of this is because we are smoking less. Men are finally coming to the table and seeking health care. And so it's probably allowing us to diagnose cancer a little bit early. Generally speaking, the risk of dying from cancer depends on the stage, meaning how far spread or how advanced it is. What that opens the door to is that if you are able to diagnose it early, you have a fighting chance of curing it with your treatment. So if we cannot prevent cancer, we can at least try and pick it up early to improve our odds of curing it. So what are the common kinds of cancer in the US? Breast cancer is common, prostate cancer, colon cancer, and cancer of the pancreas. Now, I don't need to go through the hundreds of cancers that someone can have, but it is important to start thinking about what you can do to avoid cancer if you can, or diagnose breast cancer or diagnose cancer early so you can cure it. Now, what can anyone do to avoid cancer? Clearly, we are still struggling to know the exact cause of cancer. We have risk factors, meaning there are multiple things that come together to make it possible for someone to get cancer. Some of it is genetic. You were born with some defective genes that prevent you from either correcting any errors in your genetic makeup. And so people can get cancer because they were born or they are predisposed to it. Some people like to smoke. Cigarette smoking is a risk factor for cancer, especially lung cancer, mouth and throat cancer, pancreas cancer, leukemia, bladder cancer, and many more. People like to drink. Well, alcohol is a risk factor. If you drink heavily, you are increasing the risk of breast cancer, liver cancer, pancreas cancer, mouth and throat cancer. So certainly if you can avoid drinking altogether, you are decreasing at least some of the risk of developing cancer. There are some infections that are associated with cancer. The most established of this is called HPV, human papilloma virus. There are some types of this virus associated with cancer of the cervix, cancer of the vagina, cancer of the vulva, cancer of the penis, and cancer of the throat. Fortunately, there's a vaccine for HPV. The challenge is that this vaccine has to be administered when you are young, meaning as a teenager, somewhere between age 12 and 16. And usually the kids themselves are not at the position where they can either request for this or demand. Their parents have to drive this. And unfortunately, that depends on the parental mindset to take their kids to be vaccinated. Other infections are in play. Hepatitis B is common in developing countries, especially we have it in Ghana, a lot of it. Hepatitis B is a major risk factor for liver cancer. Fortunately, again, we have a vaccine for hepatitis B, so it's a good idea to get vaccinated so that you don't get cancer. A lot of it, however, rests on early diagnosis. What that means is largely screening. When you say screening, we are screening people by doing tests on them when they don't have any complaint. They don't feel there's anything wrong, but we are testing to see if something is under the radar that could become a problem down the road. Unfortunately, we don't have screening for all our cancers. We do have established screening for some cancers, and we should take advantage of it. We have screening for breast cancer. The test is called a mammogram, and sometimes we have to do an ultrasound and MRI of the breast. We have screening for prostate cancer. A simple blood test called a PSA is a good first step. We have screening for lung cancer in people who have exposure to a lot of smoking. And we have screening for colon and rectal cancer. It's called a colonoscopy. We don't have screening for brain tumors. We don't have screening for liver cancer. We don't have screening for ovary cancer. There's a lot of cancers we don't have screening for, but the ones we do have screening for, we should take advantage of it. It's important here for me to mention that young people nowadays, people who are less than 50, there's a very strongly rising incidence of colon and rectal cancer in this population. So young people, if you are less than 50, you need to take this seriously. Cancer is not just for the aged or the very old people. Cancer is happening in younger people. I have personally taken care of an 18-year-old college student who was evaluated because he was tired. The blood test showed that he was anemic. And one thing led to another. He had a colonoscopy. He had colon cancer. He was 18 years old, college student. Fortunately, this was picked up early. He had stage 1 cancer. He had surgery. And now 25 years later, he's still alive and well and working as an engineer here in Thailand. On the other hand, I've had a 19-year-old high school student a girl, she was anemic. Everybody assumed that he had hemorrhoids because every time she had bleeding from the rectum, it was thought to be hemorrhoids. In Ghana, I guess people call it piles, and nobody really did much about it. When she got anemic, everybody thought, oh, it's because she had heavy periods. Well, ultimately, after more than a year, one thing led to another, and she was finally evaluated, and we found out she had stage 4 colon cancer. Stage 4 cancer spread to the liver. This lady died within 2 years of diagnosis at age 21. So young people still need to pay attention, in particular to colon and rectal cancer. There's screening for colon cancer. Fortunately, they have moved the beginning of screening down to 45. So if you are 45 or older, you are a candidate for screening. And don't take this lightly. Colon cancer, rectal cancer is increasing rapidly in people who are less than 50. And all it takes is colonoscopy. And it's not bad. I've had several of them. I can tell you this test is not bad at all. Now, there are other diseases we have screening for. There's pap smears, which can pick up cervical cancer early. People should take advantage of this because when cervical cancer spreads, in general, it's not curable. So we are better off getting diagnosed early if we have it so that we can get a chance to cure it. Now, men sometimes have a tendency to avoid going to the doctor and therefore getting evaluated, getting screened. Prostate cancer is real. I know so many people who have had prostate cancer. Black men, whether it's African American or African, we have the highest rate of prostate cancer in the world. And people can die from prostate cancer. When it spreads to the bones and so on, it's a miserable disease. Fortunately, this is a disease that can be picked up early with the blood test and get the biopsy, and then we can address it. Although the majority of people who are diagnosed with prostate cancer don't die from it, enough people die from prostate cancer a lot. And the pain that they go through is not a joke. So I ask all men who are over 40 to talk to their doctors about screening.
Yeah.
We can pick this up. And if you need treatment, there are lots of treatment options. The worst thing you can do is to ignore this. This is important. Unfortunately, we don't have good screening for ovary cancer. We have good screening for stomach cancer. We sometimes do liver ultrasound to evaluate for someone who's already or previously had liver cancer to see if they have developed a new one. But as I say, there are many cancers we don't have screening for. We have leukemia, brain tumors, all kinds of things. But at least the ones we have screening for, if we don't take advantage of that, that's a shame.
Wow.
Yes.
All right, Doc. I think we have a couple of questions here.
Okay.
So I can go ahead and read them, and then you can give the answers to our viewers.
Yeah.
Yeah, all right. Thank you. Okay, so our first question is coming from Phantom from Flex. He says, why is the breast the most? I think he's trying to ask why breast cancer is more prevalent.
Well, that's a good question. I think there are multiple possible explanations for this. The top three reasons why breast cancer is very common is that one, it's easier to diagnose. We can feel a mass in the breast. We have mammograms, we have ultrasound, we have MRI, we can biopsy it. Because there are people who argue that the mammograms pick up too many breast cancers that are not relevant to survival. But because you can't always tell the difference, I support getting mammograms. So I think that our test may overdiagnose breast cancer. Is one of the reasons the number is high. But I would insist that it's better to get screened and be diagnosed and addressing it than to leave it undiagnosed. Now, there are people who have all kinds of other ideas. Oh, breast cancer is common because women put a deodorant in their armpits and so on. That's not true. Breast cancer is more common in women rather than men because men don't have enough breast tissue. We have a tiny bit. So only 1% of breast cancers happen in men. If this was a disease that happened in both men and women, I can see how the number would be a lot more. But fortunately, it's largely a women's disease. Alcohol is a risk factor for breast cancer. And I'm afraid increasingly more and more women are drinking more than they should. And that's clearly a risk factor for breast cancer. Now, another thing to consider is that we have genetic predisposition to breast cancer. There's a particular gene that's well established and well known called BRCA1 and BRCA2. These genetic mutations are relative, although they're slightly less common in Black people, but they are relatively strong. People who have this mutation have up to 80% chance of getting breast cancer in their lifetime. So it's a big deal. And you inherit this from your parents, and none of us chooses who our parents are going to be. So you are born and you're born. And if you inherit a gene, you inherit it. So if we can't reverse the gene you were born with, at least we have tests that can help you either prevent it by having mastectomy so you don't get breast cancer, or at least get tests so that you can pick it up early and address it. So there are multiple reasons why you have this genetic mutation is being diagnosed more and more because we are testing more people for it. So some of it is diagnosis because of our new techniques. Some of it is our lifestyle has changed in a way that we're making it more likely to present.
Yeah, okay, Doc. So I think the next question is linked to what he just said. Mela Ventures is asking, what triggers cancer?
So there are many things that trigger cancer. It's in general, when your cells divide so that you can grow or replace damaged tissue, the body has to duplicate the cell that it already has. In other words, you start with one cell, they divide, so now you have two, and each of them divides, then you have four. During the process of copying our genetic code, occasionally there's a mistake. Instead of having this particular sequence of amino acids, there's an error in the copying, and then all of a sudden you have an abnormal gene that you didn't have before. Most of the time, these mutations are not relevant, meaning they don't cause any trouble, but they stay there. And then along the way, another mistake happens, so now you have two mutations in the cell, And often cancer requires 3, 4 multiple mistakes for it to get to the point where it's becoming cancer. Now, what are the things that make you do this? Some of it is hereditary. You inherit the predisposition to have these mutations. Some of it is because we have environmental factors that can cause this. For example, smoking, alcohol, radon gas. I'm sure those of you who live in the Northeast or Midwest, you have heard about radon around our houses. I live in Texas. Where I live, the EPA considers this area to be low risk for radon gas. Radon gas is a radioactive gas that's common around people's homes and therefore gets inside their living quarters at home. This is one of the risk factors. Asbestos, which is a physical molecule that can lead to lung cancer. You inhale it and it irritates the lung. So all these things come together lead to cancer. So there's not one thing that causes cancer. It's a multiple step process, and it's kind of an accumulation. One of the exciting things we are learning is that our bodies actually have a cancer suppressing gene array. In other words, there are genes that we are born with, and their job is to be checking our genetic code and see if there's an error. If there's a mistake, it can fix it. It can cut it out and make a new one. Unfortunately, sometimes this gene is defective in some people. So their tumor suppressing gene is not working. So now they don't have the capacity to fix errors when they occur, which allows these things to accumulate and therefore become cancer. Now, there's ultraviolet light. We get exposed to the sun. Fortunately, people with black skin are relatively protected from some of this, but still skin cancer occurs in black people. So ultraviolet light exposure is a risk factor. As I talk about this, I need to mention that black people have an increased risk of certain types of skin cancer called melanoma. Melanoma is a skin cancer that is very deadly, especially if you don't pick it up early. And black people tend to have it in what we call acral melanoma. It occurs underneath your nail beds, your toes, your sole of the foot, or your hands. And it's common for people to ignore this, especially men. They don't pay attention to their feet or their toes very much. And if you notice something black underneath the nail or the toe or the fingers, especially if it's not going away quickly, it needs to be checked. Because melanoma, if you develop it, it usually starts as a black nodule or an ulcerated mass, and it can bleed sometimes. And trust me, you want to pick this up early and have it taken care of surgically early. Because once it's spread to lymph nodes or beyond, it's pretty deadly. So the screening doesn't have to be tests. Sometimes we ourselves should be paying attention to our body and bring to attention the things that we have found. Now, if your doctor checks it out and says, oh, nothing, don't worry about it, that's nice. Sometimes they actually have to biopsy to know for sure. So there are multiple things that cause cancer. It's not just one thing. Genetic factors, environmental factors. Yes.
All right. So the next question is from Kwesi Peter. He's asking, well, probably it's because we mentioned America a lot in the US. He's asking if there's any specific cancer in Africa, which I think you already answered. I mean, it cuts across, right?
Yes, although he brings an interesting question. So I'll tell you a story about somebody that I know. I met a guy maybe about 20 years ago in Dallas. He's from Ghana, and he was diagnosed with rectal cancer. And he didn't want to believe it. He told the doctor to check it again because it might be an abscess. He says, I'm from Ghana. In Africa, we die from infection. We don't die from cancer. So go check it again. It cannot be cancer. Well, long and short of it is that he had rectal cancer, and he was lucky that it hadn't spread. He had to have surgery, radiation therapy, and all of that, and he's still alive and doing well. So yeah, so we have cancer in Africa, a lot of it, especially prostate cancer. We have a lot of prostate cancer in Africa. Now, having said all that, as we move from developing country to a new country, especially to Western countries, US, UK, Europe, the studies show that the longer we live in our new place of stay, our destination area, the more we acquire the profile of the people who are born there. In other words, you may be Ghanaian, but if you've been living in the US for 20 years and more, you are probably acquire the profile of Americans. I mean, no surprise, you are eating the cheeseburgers just like the Americans.
Yeah.
You are drinking the beer just like the Americans. You're sitting on the couch instead of getting up to walk 5 miles to the farm and back. So you are slowly, you are doing the things that Americans do. And it's no surprise that we get the cancers that Americans get. They get the heart attacks just like Americans get.
Wow. Well, thank you for that, Doc. Okay, so another question. Oh, Auntie Irene says, hello, thanks for watching us. And then another question from Phantom from Flag says, can generic cancer be eliminated in the early stages?
Genetic cancer. Well, I'm sure some of you have heard about Angelina Jolie, right? Angelina Jolie is a famous celebrity in Hollywood. She discovered, I think her mother had breast cancer. So her mother got tested. She had a BRCA1 mutation. And Angelina got tested and she inherited it. So which means she had the genetic mutation too. And she had a risk of developing breast cancer as much as 80% in her lifetime. So she chose to have bilateral mastectomy. Both breasts were removed surgically. Unfortunately, this doesn't give you 100% protection, but oh my God, it reduces it by 99%.
Okay.
Yeah, you can still have breast cancer. Yeah, so you can do something early enough to prevent the cancer. Unfortunately, we don't have everything that you can cut out. We can't cut out the heart, we can't cut out your liver. Yes. So some things are dispensable and we can take advantage of that.
All right. Thank you for that, Doctor. Another question from Chrissy Peter says, can someone easily get cancer associated with any genotype?
No, not every genotype is associated with cancer. The ones we know we can test for. Certainly, our knowledge is not complete. We are learning new things and discovering new genes and so on. So there's a long list of genetic mutations associated with cancer. If someone has a cancer that we can test for genetic mutations, especially because it may have implications for their siblings and their children. So nowadays, especially for certain cancers, we run a whole array of genetic mutations to see which one they have or which of them are abnormal, so that we can advise the patient and their families about their propensity or their risk of getting this particular cancer, so they can either pay more attention to it or get screened for it early and do other things that can minimize the risk of either developing the cancer or to help us diagnose it early. There's a lot of genetic mutations, yes.
Wow, okay. Another question says, how many stages of cancer do we have?
Okay, that's an interesting question to address. First of all, staging, there are two things you need to understand about cancer. There's staging and then there's grading. Staging relates to how fast spread the cancer is. And this is important because the outcome of treatment will depend on the stage. People who have stage 4 disease have a much lower chance of surviving it, and people who have stage 1 disease have a much higher chance of being cured. So depending on the cancer, With my stages, stage 1, stage 2, stage 3, stage 4. There are few cancers that we have a stage 5. We have some cancers that we do only up to stage 3. For example, cancer of the testis. Because our treatments are so good, we only stage it 1, 2, and 3. There's no stage 4 testis cancer. Even stage 3C testis cancer, we can cure it. And so it depends on which cancer. But generally, 1, 2, 3, 4. When you hear stage 4 cancer, usually means it's metastatic, it spread, and generally speaking, it's not curable.
Wow, that's scary.
Yes.
Wow. Another question from Phantom from Flex says, can you explain the erectile cancer a little into depth?
Can I
He wants to
explain
know
the
more about
what?
erectile cancer, yeah.
Cervical cancer?
Erectile. He said erectile cancer. So I don't know.
I don't know. Rectal, maybe rectal. There's
Probably, I
nothing
think he
called,
had rectal. So,
it probably means rectal. Okay.
yeah.
So the digestive tract begins with your stomach, and from the stomach, it goes into the food goes into the small intestine, and from small intestine, it goes into the large intestine. The last few inches of the colon is called the rectum. It's unique in the sense that it's relatively thick. Your colon can splash around inside your belly, but the rectum is kind of tethered or kind of held in place. It doesn't move around very much. And so in many ways, the rectum is just the last bit of your colon. Any cell in the body can develop cancer. And so the lining of the cells in the rectum are at risk for developing cancer. And so if you get cancer in the last bit end of the colon, it's called rectal cancer. It's unique in a way that sometimes it's easier to diagnose because it might bleed. And when somebody's bleeding rectally, although it's tempting to assume that this is hemorrhoids or piles, it's important for it to be checked because it could be rectal cancer masquerading as hemorrhoids. So don't assume any rectal bleeding is hemorrhoids until it's been checked. Another way we can tell if a rectal cancer is present is that the bowel movements become different. Sometimes the stool become pencil thin. That's because there's a narrowing or partial blockage. So the stool has to navigate the narrow area to come out. So thin or pencil thin stools is a warning that there's some kind of partial blockage. It may be scar, but it could be cancer. Some people have diarrhea. Some people have constipation. So in general, we refer to these as abnormal bowel movements. I'm sure everyone has a sense of what their typical bowel movements look like. I hope people look when they go to the bathroom. But certainly, people can have diarrhea. It's usually a short period of time. It goes away if you ate something bad or something. But if you have a persistent abnormal bowel habits, whether it's in the form of constipation or it's in the form of diarrhea, it needs to be looked at because it can be rectal cancer or colon cancer.
Okay.
Now, to the extreme end, if this blockage becomes severe enough, there's a total blockage of the rectum, then you have what we call bowel obstruction. So everything piles up, the belly gets distended, and people throw up. And that's a relatively advanced stage of the disease.
Wow.
I've had patients who actually were vomiting stool because of the blockage. So people don't need to wait till they are blocked up before they get checked. If you have pencil thin stools, if you have abnormal bowel habits, if you have rectal bleeding, please have it checked. Yes.
Okay. All right. The next question from Fidelia Awunyo says, what are the signs of breast cancer?
Okay, so hopefully people are not waiting to get signs of cancer, breast cancer before they get checked. The best time to be diagnosed or the best way to pick up cancer is when we screen with a mammogram. By the time you feel a lump, or by the time somebody feels the lump in your breast, it's already big enough to be a stage 1 or even stage 2. So you don't want to wait. But generally speaking, finding a lump in the breast is a common symptom. Bleeding from the nipple is a common symptom. Pain is usually not. So just because you are not having pain in the breast doesn't mean that the lump is not cancer. Most breast cancers are not painful. So if the question has to do with that, oh, it feels okay. I've had people who've had a lump in the breast because they didn't have any pain. They thought it was nothing. It was going to go away. And people, of course, try all kinds of supplements thinking it's going to go away, and it never does. So don't wait till you have pain, and don't wait till you have bleeding from the nipple. Mammograms are the best way to pick up cancer. But if you feel a lump, then especially if it's persistent throughout the menstrual cycle and it's not like up and down with the periods and so on, then it needs to be checked because, yeah, it can be cancer. A lump is the most common way patients can find a cancer, but we don't want to wait for that. We want to screen and find something small because sometimes the lesion is just calcium deposits that we detect on the mammogram. We don't necessarily have a mass. And these microcalcifications or calcium deposits on the mammogram is one of the ways we pick up cancer. And you can't find that with your fingers. Even your doctor cannot find it by exam. It takes a mammogram. So if there's any message I want to leave with you, getting screened where there's screening is the best thing you can do because that's the earliest way someone can pick up breast cancer.
Well said, Doc. Thank you. Okay, another question from from Flex says, please tell me this. He says he's been hearing that storing much semen in the scrotum can trigger prostate cancer. How true is that?
Sorry, say that again.
Storing a lot of semen in the scrotum can trigger prostate cancer.
No, I think there are all kinds of old wives' tales about prostate cancer. No, I don't. I think there is no evidence that I'm aware of that doing such a thing will lead to prostate cancer. No. We don't really know all the reasons why people get prostate cancer. Certainly, there are genetic predispositions. The same gene I described called BRCA1 or BRCA genes, which can cause breast cancer in women, that same gene causes prostate cancer. And so men in families where there's a lot of breast cancer, these men have an increased risk of getting prostate cancer. Mm-hmm. So yeah, there are genetic predispositions. It's not true that if you empty your testes more often, then you won't get prostate cancer. I think those are all just maybe somebody's ideas, but there's no proof of that.
Okay. All right. So the next question is coming from Victor Doe. He says, Doc, you need to come back for some more educational topics. So yeah, Doc is going to come back we're going to pick the cancers one at a time, and then he's going to go deep into it. So yeah. All right. The next question is from Mela Venture, and he says, how often should we do a pap smear and a mammogram?
Great. So a mammogram is a lot easier. The recommendation is that you should get mammograms yearly until you get to 80. After 80, you can choose to continue or you can quit. It's not because breast cancer is less common when you're over 80. It's more an issue of balancing the pros and cons, because over 80, there are a lot of competing causes of death, and breast cancer might not be one of the causes, but actually breast cancer increases with age. So yearly mammograms is the recommendation, although there are societies that think every other year is adequate. But I'm an oncologist. I'd rather have something picked up early than wait till 2 years later. And so I don't belong in a camp where people are doing screening every 2 years. No. Do mammograms once a year. Now, for prostate cancer, In general, the recommendation is get a PSA once a year. If you are scared or anxious enough, you can get it. It's a simple blood test. You can get it done twice a year if you're scared, but once a year is the recommendation. Colonoscopy, if your initial screen was completely normal, no polyps, no cancer, everything was completely normal, the recommendation is you can go for 10 years before the next one. But if we find a polyp, they need to go back in less than 5 years, because people who make polyps are at risk for making more polyps. Even if you remove the ones they have, they may be making new ones. And polyps generally can lead to cancer. Although not every polyp is a cancer risk, some of them, we call them hyperplastic polyps. These don't associate with cancer. But adenomatous polyps, which is what we are scared of, when we remove them, they don't get a chance to become cancer. So colonoscopy, every 10 years, if everything was completely normal, no polyps, but if you've had polyps removed, it needs to be repeated either every 3, 4, 5 years. Now, there are some people who have genetic predisposition to colon cancer. These people have to get screened every year. They have to get a colonoscopy every year. And it's not a joke. I can tell you of a patient that I had who had one of these genetic mutations. She was being tested every year, from teenage years. She was getting a colonoscopy every year. When she got to 25, she took a year off because she wanted to get pregnant and have a baby and so on. She got pregnant, had a baby, came back 2 years from the previous one. She had already developed colon cancer and spread to the liver in that 2 years. So yearly screening is recommended when the person has one of these genetic predispositions.
All right, Doc. So will you, at what stage will you recommend colorectal screening as to colonoscopy?
So in general, the correct answer is that if you have family members who've had colon cancer, you should start 10 years before the youngest person with colon cancer was diagnosed. In other words, if your mother got diagnosed with colon cancer or rectal cancer at age 55, then you need to start screening when you are 45.
Okay.
If there is no family history, the recommendation is that we start at 45 and get it every 10 years if there's no polyps.
Okay. So, but what about the colorectal screening?
Yeah, this is what I call colorectal screening. Now,
okay, so the one that you have to take your how do you call it, the stool.
Okay. So,
yes.
So people who have average risk for colon cancer, boy, it's raining cats and dogs. I hope you can still hear me. Can you hear me okay?
Yeah, we can hear you.
Okay. So there's a stool test where you collect your stool and send to be tested for cancer. This test is not for high-risk patients. It's for people with average risk. And there, they do it every 2 years, every 3 years, because it's simple enough. They don't wait. You don't wait for 5, 10 years to get tested again. Yes.
Okay. All right. So another question says, okay, it was just a person who thought he heard erectile cancer, but that is what he thought he heard, but that's not it. So yeah. All right then. Okay, at this point, I'm just going to take a short break and introduce the other shows that we have on the on this network, and then we'll come back and Doc is going to give us his final words.
Okay.
All right. Thank you, Doc.
Thank you.
All right. Okay, so viewers, this is Sienna Media, Sienna TV, and on Fridays we have our own DJ Mawanyega, who comes on with the African Jazz and Spotlight program for our Friday relaxation. So please tune in every Friday. That is 8 p.m. Eastern Standard Time or 7 p.m. Central Standard Time. And then on Saturdays, we are here with the Health and Wellness Hub, 9:30 a.m. Central Standard Time and 10:30 a.m. Eastern Standard Time. After that, we have the Empress Mousy and FO Steve will come all with the Sienna Central Talk Show. And that is at 11 from 11 a.m. Eastern Standard Time to 12 noon. And that will be 10:30 right after our show here, 10:30 Central Standard Time. And then after that, we have Dunenyo Bobobo all the way from Ghana in collaboration with Top Radio. On Baba Ebefa comes our way with Dunenyo Bobobo show. And then after that, we have Mr. Obegbe. Yes, Mr. Obegbe. That comes on after Dr. Dogbe, Dr. Wanyo, and his entourage also come here to teach us our Ewe language. And that is about it for Saturdays. On Sundays, our sister Nicole also comes our way with Afrique with you. She hosts a lot of people who come on here to talk about faith and culture. So basically, these are the shows that we have on this channel, Sienna Media and TV. Please share the link, subscribe to our channel. So when we're live, you hear the notification button and then you can join us. We bring a lot of experience, our healthcare professionals here. We talk about everything that concerns our health and our wellness. So please don't miss any show. Even if you miss a live show, you can always go back and watch it. We are always live on YouTube and Facebook. You can always go back and watch it. So please keep watching and keep spreading the news and keep subscribing to our channel so we can grow it and continue to learn and educate ourselves to live healthier lives. All right, Doc. So your last word for us about cancers in general.
Okay. So there's a topic I haven't addressed in any of the questions. If someone is suspected to have cancer, we should have it evaluated. That evaluation should include a biopsy. And once we diagnose it, then the next step is how aggressive is the cancer? There are some cancers that are very slow growing and some of them are very aggressive. And then we do what they call the staging. Is it a stage 1 cancer, stage 2, stage 3, or stage 4? And that usually is a measure of whether the cancer is spread to other organs, like it's spread to the liver or to the bone or something. That makes it a stage 4, or if it's spread to lymph nodes. Now, that stage will determine how we should treat the cancer. Cancers in general that are very early stage can be treated surgically. Somebody can go in there and cut out the tumor, make sure they get all the tissue surrounding it so that the margins are clear. So surgery is an important treatment for early stage. But I want to mention that there are some cancers, all we do is observe or monitor it. Some cancers are so slow growing, they don't even need treatment. We have prostate cancer patients who have low risk prostate cancer, and the recommendation is to monitor and not treat. We have leukemias, what we call CLL, chronic lymphocytic leukemia. If they don't meet certain criteria, they don't require treatment. So observation is part of what we do to manage cancer. Early stage cancers, we can treat with surgery, but beyond that, sometimes we do radiation. Radiation comes in many different forms. Radiation is kind of like X-ray, except it's high energy X-ray that is used to treat the cancer. Don't forget that radiation, it's kind of like surgery. It's local treatment. It doesn't address any cell that may have escaped already and gone somewhere and hiding somewhere dormantly until they wake up later. So surgery and radiation are local treatments. They don't take care of cells that have escaped already from where the cancer started. And so sometimes we have to do systemic treatment, treatment that can go beyond where the cancer is. So such a treatment may have to go into the blood, either intravenously or you take it by mouth and it goes into the bloodstream and it can get to all these other places. And there are many types of systemic treatment we have. We have chemotherapy. We have immune therapy where we harness the body's own immune system to fight the cancer. We have some targeted therapies where we identify a particular mutation that's driving that person's cancer, and there are specific designer drug designed for that particular mutation. So we call those immune therapy. And there are other treatments called cryotherapy, where some cancers can be frozen away. People have tried that in some cancers. In general, it's not as established as some of the other treatments that I've outlined. And always we have what we call experimental therapy. We are constantly researching a more effective therapy or safer therapy or treatments with less side effects so that we can improve on the outcomes, not just for the surviving the cancer, but to have fewer side effects and therefore better tolerance of our treatment. So today's experimental therapies are going to be tomorrow's standard therapies. So if someone has cancer and they are offered the opportunity to enroll in a clinical trial, it's not a bad idea because you might contribute to, if it doesn't help you personally, it's possible to help somebody down the road, and that by itself is valuable. So treatment depends on the stage of the cancer, and it also depends upon what the expected side effects, the aggressiveness of the cancer you have. These are the things that determine the choice. Clearly, there are adverse or side effects of these treatments, and some of them cause hair loss, some of them cause nausea, vomiting, fatigue, low blood counts. But in general, these are side effects that can go away once the treatments are done. This compares sharply with symptoms from the cancer, which does not go away unless the cancer is treated. So as people focus on side effects of treatment, they need to remember that generally speaking, treatment side effects are temporary. But symptoms of cancer, which is uncontrolled, only get worse. And it's a lot worse than side effects of treatment. Okay, so as we leave here today, I want to be sure that people understand that cancer is really a basket of different diseases. Not every cancer is the same. Even if two people have breast cancer, their cancers may be different. And number two, there's screening for cancers, and we should take advantage of those cancers where we have screening so we can identify problems before they become serious. And always don't forget that treatment depends on the kind of cancer you have and what treatments have been established to be of value. And so we should seek care from people who have the experience of doing this all the time so we can get the most out of it. And with that, cancer is not always a deadly disease. People survive cancer. I have personally known many cancer patients who have survived their cancer, so it's not a death sentence. But we need to do more, either as a treating population of people or patients. We ought to do more to prevent cancer and to diagnose cancer early so we can have better outcomes. So don't forget, remind your family members about these things that we have shared today. It may not be of value to you personally, but you can help somebody's, you can save a life by sharing and encourage somebody to do some of these things. Thank you very much.
All right. Thank you so much, Dr. Michael Ashigbe. This has been a very educative section. I have personally learned a lot. And you have assured us, viewers, Dr. has assured us that cancer is not as deadly as we think. The key is early screening. So let us not take our screenings lightly. Let's go any yearly tests, the established ones that we need to do yearly. Let's make sure we are able to do it. The other ones that we don't have control over, whenever they show up, God will make a way. So thank you so much, Doctor. We are blessed to have had you here, and we know we'll have you here another time to give us more knowledge on cancers. Thank you so much for watching us on the has been the Health and Wellness Hub, and thank you for watching every Saturday. Next Saturday we'll be here with another topic. So please Share the link and always subscribe to our channel as well. And always remember your health is your wealth. Thank you for staying with us. And until we come your way again next Saturday, stay healthy. Bye bye.
Bye bye. Thank you for having me.
Thank you too.